Imagine you're the only emergency doctor on duty. Two patients arrive at exactly the same time, but you have only one operating room immediately available. Looking at this split panel, we see patient A on the left. He is 28 years old and was involved in a motorcycle accident. He has severe abdominal pain and is actively losing blood. As the chart indicates, his blood pressure is dropping. However, he is fully awake and talking. Now look at the right side of the panel, showing patient B. She is 67 years old and suddenly collapsed while shopping. She is completely unconscious, breathing with the assistance of a ventilator, and the ambulance crew suspects a major stroke. Both patients need surgery, but as this central icon shows, your resources are capped. The hospital's second operating theater will not be ready for another 30 minutes. One patient can be treated now, the other must wait. Based on these initial reports, you have to decide. If you were the doctor on duty, who would you treat first? Your thinking time starts now. Whatever choice you just made, you use the limited baseline facts available to form an immediate priority. In high-stakes situations, we all rely on our initial intuition to triage the problems in front of us. Let us look at the new data coming in. This logic tree diagrams the trauma team's updated assessment of patient A. While he does have serious internal bleeding, his airway remains perfectly stable, and his oxygen levels are normal. Extending this data into a timeline, the surgeons provide a clear window. Because his condition is holding steady, they can safely control the bleeding as long as surgery begins within the next 30 minutes. We shift our focus to patient B. The neurologist has reviewed her brain scan, and this schematic confirms a large blood clot blocking a major arterial pathway. The neurologist provides a critical metric. As represented by this rapidly depleting progress bar, for every single minute this artery remains blocked, patient B permanently loses approximately 1.9 million brain cells. Comparing their current trajectories side by side reveals a stark contrast. Patient A remains conscious, speaking, and stable over the last 10 minutes, represented by the horizontal line. Patient B is becoming increasingly difficult to ventilate, and her risk of permanent brain damage is climbing exponentially on the right. The evidence has updated. Does this new information change your initial conclusion? You must decide now. Making this call requires moving past a static evaluation of who looks sicker. The core of the dilemma has shifted to a dynamic calculation of who is actively losing time. The better supported decision is option B. You must treat the older patient with the confirmed stroke first. This comparison of risk metrics explains why. Stroke treatment is extremely time-sensitive. Patient B is suffering irreversible cellular loss every minute she waits. Patient A has serious injuries, but his condition is currently stabilized, and he can tolerate a short delay. If you initially chose patient A, your reaction is common. We are drawn to his profile because youth, dramatic motorcycle accidents, and visible blood loss create a strong sense of urgency. Psychologists call this salience bias. Visible injuries capture our attention quickly. But strong critical thinking requires setting aside the dramatic appearance of a problem to evaluate the objective data underneath it. True triage does not mean treating the most visually shocking wound. It means prioritizing the prevention of irreversible damage. In everyday life, the loudest problem is rarely the most urgent one to solve. When you face competing priorities at work or in your personal life, you can apply this framework. First, base your decisions on objective evidence rather than emotion. Second, identify which factors are strictly time-critical. Third, actively avoid appearance biases that make flashy problems look urgent. Most importantly, you must be willing to update your initial conclusion. As new data arrives, strong thinkers revise their beliefs to match the facts. What did you decide, and how did your reasoning evolve? Tell us the specific pathway that led to your conclusion in the comments below. Pause and question your emotional reactions. That simple habit leads to better decisions. If you enjoyed this challenge, please subscribe to Question Your Mind Daily. One question every day. Better thinking for life.